name is Rajnish Mehrotra. I'm the Editor-in-Chief for CJASN. I'm here with Insa. Hey Insa, can you introduce yourself to the CJASN audience?
Yes, my name is Insa Schmidt, and I'm an assistant professor at Boston University and Boston Medical Center. And before I joined BU School of Medicine, as faculty, I did a postdoctoral fellowship here, and the work published in CJASN we're talking about today results from this time.
Nice. What sparked your interest in biomarkers in kidney disease?
So my passion for biomarker research dates back almost to medical school and then clinical training, where I became aware of current limitations to diagnose and treat kidney diseases and realized the importance of discovery and testing of novel diagnostics to advance patient care. And I believe that biomarker studies in nephrology really is an area of medicine where scientific advances to increase diagnostic and prognostic precision are much needed.
What is the gap in knowledge that you hope to bridge with your work with regards to biomarkers?
So the main markers we currently use to diagnose and stage CKD, as we know, eGFR and proteinuria, provide reasonable risk prediction for kidney disease outcomes, but they have limitations as they do not capture histopathologic correlates of the underlying disease or yield specific information about individual prognoses. And so with this work, we hope to discover new plasma proteins or protein signatures that would be associated with histopathologic lesions and prognosis in human kidney disease to enhance clinical phenotyping of CKD.
What did you find with your work?
So in this study, we used the Olink proteomics platform, and we measured 225 plasma proteins in 549 participants of the Boston kidney biopsy cohort. And we identified several biomarkers associated with kidney disease, histopathology, and prognosis. So for example, we found that the top performing markers positively associated with acute tubular injury and interstitial fibrosis and tubular atrophy, or kidney injury molecule 1, also known as KIM1, and then VSET and immunoglobulin domain containing protein 2, which has not been studied at all previously in the setting of CKD. And across the 30 proteins that were associated with a higher risk of kidney disease progression, we observed the strongest association with placental growth factor, a member of the VEGF family that has been studied in preeclampsia. And interestingly, among the 35 markers associated with death, we found 5 biomarkers that had an inverse association with death. And here the top performing marker was stem cell factor, or SCF, and low levels of SCF have also been reported to be associated with mortality in previous studies. So many of the markers identified in our study have not been reported previously and may represent important avenues for future research, including mechanistic and physiology studies.
Interesting. Let's just take a step back. What would you say, how does your work fit into this larger body of work that has been done with biomarkers?
So I would say most studies to date haven't been performed in cohorts with biopsy-confirmed kidney disease. And we measured out our proteomics panel in a cohort study of patients with CKD and semi-quantitative assessment by 2 kidney pathologists. And I believe that this is an important contribution to the ongoing quest for the identification of non-invasive estimates of kidney pathology and prognosis.
Right. I mean, that makes a lot of sense. I mean, I think this is, in what you have done, clearly is a meaningful advance in our knowledge. What are the next steps in your research? And more broadly, for the field of biomarkers in kidney disease, where do you think the field is headed?
So I'm very interested in expanding our proteomics approach in the Boston kidney biopsy cohort to also encompass several thousand proteins and combine this with metabolomics and spatial transcriptomics so that we could identify regulatory pathways and relationships across cell types in CKD tissue. And then more broadly, I think the field of biomarker studies will benefit from more mechanistic studies to better understand the underlying biology of markers we have identified in studies to date. And then Additionally, the combination of multiple types of data, so for example, exposomics or data on allostatic load with biomarkers, will also provide interesting new insights in causes of CKD, I believe.
Yeah, this is very important. Congratulations again for being selected to be the prize recipient this year. What words of advice or wisdom do you have for people that are contemplating or just starting the research training with a focus on kidney diseases?
I think being persistent will certainly help to overcome many obstacles. But for most, I would say identify a research topic that you feel truly passionate about. So from biomarkers to social epidemiology, kidney research has so much to offer, and I believe we always do best when we love what we do.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.